Hello, my name is Ashlie Whitt, and today I will talk about Patricia Benner's stages of nursing proficiency. According to Alice Peptrin in 2016 in her article, Patricia Benner's Novice to Expert Nursing Theorist. Patricia Benner has an extensive background in the nursing education, working her way up from a bachelor's to a PhD in the science of nursing. She graduated from Pasadena in 1964 with a bachelor's in nursing. After her bachelor's, she attended the University of California, where she earned a master's degree in medical surgical nursing, and in 1982 she finished her education with her PhD. Patricia Benner has a considerable amount of work experience, including head nurse, research assistant, professor, and author. In the early years of Benner's career, she worked on the medical surgical floor on the coronary unit as head nurse. After graduating from the University of California with her master's, she worked as a research associate for the school from 1970 to 1975. She became a professor at the University of California, where she graduated after the completion of her PhD. Benner is also an author. In addition to being a nurse, she has co-authored 12 other novels. Her work extends beyond the practice of nursing and provides light about the subject of clinical ethics as well. Black in 2014 in Professional Nursing Concepts and Challenges describes Benner's theory of stages of nursing proficiency. The theory describes how nurses make the transition from beginners to expert nurses. In stage 1 of Benner's theory explains what she calls a novice nurse. The novice nurse is a student nurse that depends on the rules of the hospital heavily and is uncomfortable in hospital settings because of little experience. In stage 2, which Benner describes as the advanced beginner nurse, is the nurse recently graduated from school. The nurse considers everything that was learned in school as priority and has a difficult time with time management. In stage 3 of Benner's theory, the nurse is known as the competent practitioner. The competent practitioner has 2 to 3 years of experience in the field and are much more organized than the advanced beginner nurse. After 3 to 5 years of experience, the nurse enters the proficient practitioner stage. The proficient practitioner is worried about the patient and the rules and the regulations of the institution. The completion of the stage ends in expert practitioner, and the process of nursing becomes natural. Black in 2014 in Professional Nursing Concepts and Challenges embodied Benner's theory as she captured the progression from a novice to an expert nurse. In regards to Hill's thoughts in 2010 in an article Improving Quality and Safety by Retaining Nursing Experience, Benner has years of nursing experience and can recognize what other beginning nurses are experiencing. The theory recognizes that there is a significant skill level difference between that of an inexperienced and an experienced nurse. The theory considers that the level of experience will determine how a nurse acts in each instance. She guides you through a simple process in how a nurse will progress in the practice. According to Chassie and Gobbett on page 132 in 2008 in their article Towards an Alternative in Benner's Theory cannot accurately describe the complicated process of the progression of a nursing expert. The limitations of Benner's theory is that human development is unique and going to affect everyone differently. The human condition is difficult to explain by stages because everyone progresses differently and some not at all. The theory suggests that everyone will gradually increase in each subfield that Benner describes. However, some may take longer to excel in some subfields than others, Chassie and Gobbett point out in 2008. The theory also does not recognize how holistic the nursing profession is, that there are various factors that play in the progression of nursing skill sets. Benner's nursing theory can be used to give the nurse a sense of how they have advanced in the workplace. When the novice nurse feels discouraged at the skill level of other nurses, the novice nurse can justify this with the amount of experience each nurse has. The entry-level nurse can use the theory to help understand how to comply with the rules of the hospital while still giving their patients the best care. This view on nursing made sense to me. Being a CNA, I went through a similar experience when interacting with my patients and the rules of the institution. When I first started the job, I went through a similar situation where I didn't exactly know how to help others to the best of my ability. This discouraged me because of how well others were able to give and overachieve while I was just getting by. Throughout the journey, I acquired the skills I needed to be successful as well as satisfy my patients. This concludes my presentation on Patricia Benner's stages of nursing proficiency.